Spectrum Health's lead management program is dedicated to helping patients make decisions around leads that have been implanted in their heart. Leads are small wires that carry electrical signals to the heart to either increase heart rate, such as in that of a pacemaker, or deliver a high-energy shock to help patients get out of a life-threatening arrhythmia, such as that of a defibrillator. These leads over time can have problems. They can become infected, or they can fracture and break down and become dysfunctional. In those scenarios, we have to make a decision about taking the leads out of the body, and this is called an extraction. A lead management program does not necessarily mean a lead extraction program. Extraction is a component of lead management, but we have to take an overall comprehensive view of everything to make that important decision.
There are scenarios where you don't have an option, and removal or extraction of the leads is the right decision for a patient. For instance, if you have an infection, many infections would not clear if you do not take out the pacemaker or defibrillator wires. For other indications, you get to choose between leaving a lead in place and taking it out. Often if a patient is young and they have a broken lead, I would recommend we take out the lead, because even the new lead that we put in is likely to break over the remainder of their lifetime. If a vein is occluded and you have a broken lead, or we wanted to add another lead to upgrade your device, for instance from a pacemaker to a defibrillator, we may not have the option to put another lead in that area unless we took a lead out to make room for another one.
The first part of a lead extraction is always consultation with the patient, and also consultation with our multidisciplinary team, which would include cardiac surgery, sometimes infectious disease, anesthesia, and as well as our other cardiology colleagues. The consultation is really intended to determine whether lead extraction is the appropriate clinical course of action for the patient. After we make that decision, then patients will present to our Meyer Heart Center, and they will meet on the day of the procedure with myself and our anesthesia team. The procedure is conducted under general anesthesia, so patients will be asleep during the process. After all the preparatory work is done, we insert some IV catheters in the upper legs, and we use those to infuse medications that might help support the patient during the procedure. We open the pocket, and then using specialized tools, a laser and a cutting sheath, we track along the leads and break up tissue that has formed, holding those leads in place. And once we have effectively broken up enough of that tissue, the leads can be successfully removed. All this is performed in a hybrid operating room with a major complication risk of 1% or less to the patient.
For most patients who come in and have a lead extraction procedure, they leave the following morning. Recovery is usually very similar to when you had your device put in. You might have some pain in the area of the incision or in the groins where we put the special IVs in, but most people are able to go back to work within a few days.
As cardiac electrophysiologists, our procedure is minimally invasive, and we rely on imaging such as X-ray and fluoroscopy to perform our procedure. In the course of doing our procedure, if we were to injure a blood vessel or the heart, that would require rapid transition of that procedure to one where a cardiac surgeon could come in, open the chest, and make the repair. A hybrid operating room allows that transition to happen fairly seamlessly because it provides all the tools and equipment needed for that cardiac surgeon. So the benefits of a hybrid operating room really are in the rapid transition from one procedure to another. This is something that cannot be performed as easily in just an electrophysiology lab or in a standard operating room.
For a patient who we may be considering a lead extraction that does not have an infection, for instance, if you just needed a new wire because one was broken, or we wanted to add another because we were going to upgrade your system from maybe a pacemaker to a defibrillator, your option is always to leave the lead in place or abandon the lead. For some patients, that's the right choice. Not every patient is a good candidate for a lead extraction.
Spectrum Health has a very comprehensive, thoughtful, multidisciplinary approach to lead extraction. We have the only lead extraction program in West Michigan, and we have a very dedicated team of anesthesiologists, cardiac surgeons, infectious disease doctors, and cardiologists. Studies with thousands of patients show that when centers do over 30 extractions per year, the complication rates are lower and outcomes are better. At Spectrum Health last year, we did over 70 lead extractions and are considered a high-volume center. I think certainly our patient satisfaction and outcomes really speak to that.